Hello.
Hi, Emily. How are you?
Very well, thank you. And you?
I'm recovering, giving thanks. I'm good.
Good. And do we have the chief medical officer? In a moment, we will have her.
I'm not sure. I'm not in the same location, but she should
Yes,
be on.
I know.
Yeah.
All right. Let's start with the issues now directly in front of us. I don't usually preempt you in this segment because you're at liberty to bring what you want, but this is so topical. Firstly, the Gleaner's headline this morning, gasping for air. Nearly half of ventilators in public system out of service and some hospitals without critical equipment. That headline has come, and I have received a press release from your ministry saying misleading media headline on ventilators.
Right.
What is misleading about what the Gleaner has put out? How many ventilators? Have we lost the minister? I think we lost him. We're going to reconnect with the minister in just a moment. The minister's, one of his speeches says, and this is what he told us, two of the 210 ventilators in the asset registry, 118 are in use and fully functional. Okay, so 118 divided by 210 times 100, that is 56% in use. Yeah. Then it says 92 are not in use. So this is now 92 divided by 210 times 100. Minister?
Yes, I'm not sure what happened there.
Yes, so sorry.
So I was saying that we had a press brief yesterday to clear up some of the issues that have been topical, ventilators being one, and we tried to address the insinuation that somehow ventilators have gone missing, as raised by the opposition, and gave an account which I stated specifically how many were in the system, registered, how many were decommissioned, meaning they were there waiting on the board of. There's a board that you have to appeal to that validates these things for them to be disposed of. So very tedious process in government, beds, chairs, everything. And those were taken out, and how many were in active use, and how many were out for servicing. It turned out that about 118, 120 were in active use, about 40 for servicing, and the rest was to be decommissioned. What the headline did was to take the full amount and made a determination about what was not in use, which was the 40-odd%, without accounting for those which we specifically stated were decommissioned and would be disposed of. And that made the margins or the percentages look a little distressing, and I appreciate how that would look. And what we sought to do was to try and clarify that. The second issue about gasping for breath, I think, was very inflated because the CMO, Chief Medical Officer, was on. She spoke directly to ventilators and their availability in the public health system. And indeed expressed the view that 120 ventilators, given the way our system is structured, and the ICU and the high-intensity units and so on that are available, and the referral systems that are in place, 120 ventilators is adequate for the needs of the population. Those were very specific. So when you juxtapose that against gasping for breath, even though the body of the article, I must admit, sought to do a better job at explaining, but people read headlines. The headlines really were misleading, and since to avoid the panic in the society, we opted to send something out to say that the headlines are misleading.
But can I just pause you there? You are the one who told us that you have 210 ventilators in the asset registry.
Right.
So you, in your 210, what you've done is combined the 118 that's working
Plus the 40.
Plus 40 that's out for maintenance.
Right.
And the 52 that are obsolete. That's how you got your 210.
That's how we got the 210, yes.
Yes, and to find, if you tell us now that 118 are working, to find the percentages, the 118 becomes your numerator, the 210 becomes your denominator multiplied by 100, 56% working. 92 therefore are not working, 40 of which have gone for maintenance, and 52 are obsolete.
Right.
So I think, based on how you've put it, the Gleaner's calculation of the percentages, the calculation is accurate.
Well, what I'm talking about is total headline. The headline was really gasping for breath. That was the headline. The other subtitle or subheadline is a lesser headline. And what we tried to address was the mischief we thought, or the injury that is created through perception, that somehow ventilators are missing in the system and are creating the gasping for breath that the headline symbolized. And what the CMO said is that this is not the case. 120 functional ventilators, with the rest being in service but being serviced, is adequate to address the population and the needs of the population. Of course, it's a moving target because it changes on a daily basis, and that's the injury that we're trying to correct.
Yeah, but
I think it's important.
Yeah, but I don't think you have to pick your battles well, because you can't tell the editors what headlines to put up.
I can't, but I can certainly comment on it, and I think.
Your comment is it's really. As I said, you really have to choose your battles. Gasping for air within the context where you have 92 ventilators out of 210. 92 are not working. 52 of the 92 are obsolete. 40 are out for maintenance. Then that takes you up to a 43%, 56% of the 92 being obsolete. Yeah, so 52 of the 92. So I don't think that's a battle that you need to fight, Minister. But let me take a break and come back with you. The CMO joins me in a moment.
Quote by Renew, JNGI online.
My JNGI is
15 minutes before 11.
Thank you, listeners. You're on the pulse with Public Health. On the hotline, the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. She joins the Minister of Health, Dr. Tufton, in this edition of On the Pulse. Can I thank you so much for joining us, CMO?
Hi, morning, Emily. Morning to your listeners. Morning, Minister.
Morning.
Morning.
May I ask you, what's the maintenance protocol for the ventilators or other equipment that's used in the public health system? Specifically the ventilators, but can we begin with that? How do we service them? How often? Whose responsibility is it?
Well, you're asking me a difficult question. But the thing is that each of the regional health authorities and all different hospitals would have different arrangements in place. Ventilators are something that are frequent. They have to be assessed every day before they are utilized to make sure that they're in good working condition. Mm-hmm. And that's why it is so difficult to give a precise number that is going to be consistent from day to day as to what is working or what is not working. Because they're such a critical piece of equipment, the very slightest problem could take them out of action for a day or for a week or sometimes even longer.
Yes.
And so it's really unfortunate that we're trying to focus on a number to say that we have a number that is working, because it is going to change daily, Emily, because these things are very sensitive pieces of equipment. We do use them very frequently. And so we have to assess on a daily basis. And even, this week we had a situation at Bustamante that 1 week we had 3 down. And fortunately, they were able to work to get the parts in and to have those up and ready by 2 weeks later. And so we were up to, again, 8 that were working.
But even though you do daily checks, do you have a 2 week period where if oil is needed Or if whatever part needs to be changed, do you have any sort of cycle for those things to be done?
I couldn't give you that information because I'm sure it's going to vary dependent on the type of machine, the actual utilization pattern of the machine, and the kind of service contracts and service personnel that are in place.
But is there an individual in each of the hospitals who has responsibility for that thing that you can't give me the answer on now?
There should be. We have a certain group of persons that we are trying to formalize in the system called the anesthetic technicians, who assist the anesthesiologist in ensuring that the machines are working. Otherwise, from the anesthetic technicians, we do have the maintenance persons. And as I said, for most of the equipment that we're bringing in now, we have service contracts that we would have be still engaged with the provider of the equipment in terms of provision of parts and maintenance.
Right. And when one goes down, what's the average time for the repair? We understand there are 40 now, 40 out of the 210 that are out for maintenance. What's the average time for repair of each?
I can't tell you that because it depends on what is happening to it. And as I said, the numbers vary because when I personally physically called the departments and the SMOs yesterday, and I have that just about 100 are working. But maybe if I call next week, it will be 70, I see you have a number of 40. I'm not sure where you got that from.
That's what the minister gave at the press conference. 40 are out for maintenance out of the 210.
What I said is are working. When I called yesterday and spoke to the SMOs, we have about 100 that are working. And what that 100 working does, it does give us a little bit of elasticity in terms of ventilators, because where they are able to rotate ventilators in some facilities that they would never have been able to do so before, and they would have spares. But it all depends on what is happening in a facility at a particular point in time. You may have a 5-bed ICU, but you have 7 patients, and you so happen to have 7 ventilators. So you can take in 2 patients who need ventilator support, but it means that you have to stretch your staff to be able, where you would have a 1-in-1 nursing, ideally, have one nurse maybe nursing 2 patients or even 3 patients. So the flexibility in terms of having the space, it's not just only dependent on the ventilator, but right now we are in a good position in terms of ventilators, because remember before COVID, when we spoke about ventilators that we had in the system, we were talking about between 20 to 30 ventilators. And so now having about 100, as I'm saying from my check yesterday, that are working, does give us elasticity in that if one goes down, we are able to have another in a facility, not in every facility, but in some facilities. But there are other things that may prevent us from being able to take that patient. And I just want to say that even though sometimes we may not be able to take a patient into an intensive care space, and that would be ideal for us to have, it's not that we not continue to manage the patient and do the best to optimize the care of the patient. But an ICU space offers more than just ventilation. It offers the multidisciplinary kind of care, the kind of laboratory support, everything else that is needed to support a critically ill patient. Now, if I'm nursing a patient in a hospital that does not, say, for example, have a pulmonologist, then I may have the person who is an internal medicine specialist that is managing the patient. But if I move the patient to a space where I have that service, then it does optimize further the care that the patient would have based on the specialist input. So there are so many things that are involved in terms of managing critically ill patients. And we are, to me, in my mind, when we focus on ventilators, it can either look good or look bad, because it certainly looks good because we have more than we've ever had in the system. We have an elasticity that we've never had before in some of our facilities. But then it can look bad if we don't have the intensive care space all the time, immediately as we need it, because we're not able to pull together everything at one time in a particular facility.
Part of the problem is that the person who is raising the questions is actually a medical doctor who knows how a hospital is supposed to operate. And he's saying, in fact, the response from the PNP this morning is that they're gravely concerned about the critical shortage of ICU space and trained personnel to operate ventilators in hospitals across Jamaica. Is it the case that we have a critical shortage of ICU spaces, CMO?
Emily, the thing is that no, I don't think there is any health system that can cater for any eventuality that can happen. And the demands changes periodically throughout the year. The fact is that, look at COVID, we had health systems in big countries like Italy and Spain that went down because they were not able to meet a particular demand at a particular time. For a third world country like Jamaica, the size of the shock that would put us in that position is going to be smaller. So you will find that from time to time, different facilities will come under a shortage of supply because of a particular need at that particular time. And, you know, this period of time is a critical period of time, this June, July, August. And because there's a high demand, especially for neonatal space and intensive care space. And we would have, had discussions with our senior medical officers, to try to optimize the service that we have in every way possible, to ensure that we are able to meet the demand. And that may mean putting other things in place separate from ventilators, but just making sure that we're able to reach our nurses, to be able to train up some of the nurses that are not necessarily intensive care nurses, to be able to give some kind of management, to have our doctors more prepared, to watch our infection prevention control measures to make sure that we don't have babies becoming infected, to make sure that we have critical supplies in place. So there's so many things that will contribute to us having a space. I cannot say that at this particular time, I would say that there's a critical shortage of ICU space, but I know that tomorrow in a facility where that comes under heavy demand because something happens tonight, there may be a shortage tomorrow that we would have to deal with within the health system. And that is why this is a connected up health system, that one hospital helps another. That's why we refer patients. If it is that we can't support you in one facility, then we get you to another facility that we can support you. That's why we have this connected up system, because at different times, the different shocks will affect different parts of the system. But overall, I think that we do have the capacity, if we cooperate with one another, if we support one another, we work together, we let the referral system work as it should work. And as you correctly say, that our maintenance people are up to scratch and doing what it is that they are supposed to do, I do believe that we have the capacity to make everything work together to support our patients.
I'll take a call, 876-926-2178. Minister, you want to come in? 926-7615.
Well, we only have 3 minutes to the program, so
yeah.
I'll listen for the call.
All right, let's see what the callers have to say. Whilst my producer gets one on, the PNP also says that they're concerned about the maternal mortality crisis in the Southeast Regional Health Authority. Is there a crisis, Dr. Bisesa McKenzie?
You ask me as head of technical services division, I would say that we're in a place that we need to urgently address some of the issues, because we do have a target. Granted, it's a United Nations target of reducing maternal mortality to 70 per 100,000 live births. And right now we're at about 130, coming down from 211 in 2021 where we had the effects of COVID affecting our mothers. We have a good space a gap to cover, and we have put several measures in place. We are working with the teams on the ground. We have made sure since the beginning of this year, to move out into the regions, to have the meetings to discuss what are the local things that are happening that we need to address to ensure that we give our mothers the best chance of survival. And I must say that the antenatal period is a critical period for us to ensure that the mothers have the information, that they are attending the antenatal clinics, not just one clinic, but once a month for the first 28 weeks of pregnancy, twice per month thereafter until the last 4 weeks of pregnancy, when it's once a week until they deliver, so that they can be able to say what is happening to them, that there can be early interventions, that their needs in terms of the control of their chronic non-communicable diseases that are rising not just in the general population but also in the antenatal population, that we can address them, get their diabetes under control, their hypertension under control, decrease their risk of running into problems later. Importantly, get them attention to their diets. You know that anemia is a big problem that causes postpartum hemorrhage to be worse, and we need to get that addressed. So the antenatal period is a very critical period. We're about to launch a campaign.
Let's give you a couple minutes after, because you came on late, to take some questions from the listeners. We'll call you both right back if that's okay. It's headlines time. Thank you so much, Chief Medical Officer Dr. Jacqueline Bisesa, Mackenzie Health Minister Dr. Tufton.